On behalf of the Social Democrats, I'd like to move the motion on the cost of cancer care. I also have to say that it's disappointing that the Minister for Health isn't here to listen to this. Cancer care is a huge element of the health service, and it really is quite disappointing that he's not present here. There's not in the country and he's off some business event, and that's a pity. Lascan Corley, with the agreement of the House, I wish to share my time with Deputies Whitmore and Gannon. Lascan Corley, every 3 minutes in Ireland, someone receives a cancer diagnosis. Sitting in doctors' offices up and down the country, across every village, town and city, it's a largely indiscriminate disease. Many patients say that the minute they hear the word cancer, it feels like their whole world has been turned upside down, like they're losing control. Most of us at one point or another have thought about and worried about receiving this life-changing diagnosis. But most people haven't thought about the costs associated with that diagnosis. And the reason for that is because they shouldn't have to. But the reality is that a cancer diagnosis comes with a hefty bill, with some patients facing financial crisis alongside their treatment. In a 2019 Irish Cancer Society survey into the experiences of cancer patients and survivors, one participant described it as, I quote, "like a bomb went off. It cost a lot of money and has left me weak and in need of financial assistance." Another said, "I'm just 17 days into being diagnosed. It's complete turmoil, and as it goes on, the financial burden is sinking in." This survey is filled with harrowing testimonies which paint a shameful picture, leaving you with no doubt that the state is failing cancer patients in many ways. The myriad of expenses, which are often unexpected, can at times feel endless. Medication, GP visits, specialist dressings, travel, wigs, and additional dental care, to name but a few. For the patients who do not meet the strict medical card income limits or cannot afford private health insurance, the financial strain is even greater. They are essentially left adrift with no financial support at a time when their physical and psychological energy reserves are low. As a 2018 report into health inequalities in Europe put it, these are the patients stuck in the twilight zone of the Irish health service. They're at the sharp end of a two-tier health system, incurring €80 inpatient charges per hospital visit. While this is capped at a maximum of €800 per year, it should be noted that a high proportion of patients end up paying the maximum rate as their course of chemotherapy or radiotherapy requires more than 10 visits a year. And for many patients, their first introduction to these inpatient charges is often upon receipt of an invoice. Understandably enough, some newly diagnosed cancer patients are not even aware that these charges exist. They assume that their treatment is free, particularly the day services. Last year, one woman told the Irish Cancer Society that she found out about the inpatient charge the morning of her first chemo session. Imagine learning about this unexpected cost just before your first chemo session, as if you wouldn't be frightened and stressed enough already. But for many people, it's the speed with which bills, reminders, and even debt collector letters are issued that really distresses them. Invoices often come through the door while patients are still recovering from the treatment that they are being billed for. In one case, a patient received 19 separate correspondences from the hospital and debt collection agency. It's quite remarkable how efficient the health service can be when it's owed money. The practice of hiring debt collectors is especially disgraceful in my view. It is meant to intimidate patients who, with everything else going on in their lives during treatment, may just not have got around to paying. Or maybe they just don't have the money. Or maybe they're waiting for the outcome of their medical card application. Frankly, the reason doesn't really matter, Minister. What matters is the absolute lack of sensitivity and understanding being shown to cancer patients. One cancer patient described the debt collector's relentless pursuit as bullying. She was told that if she didn't pay up, her name would be blacklisted for things like car loans or home loans or even mobile phone contracts. And instead of winding down this deplorable practice, it appears that the HSE has actually intensified its pursuit of patients. It spent more than €4 million on debt collection agencies in the 7 years up to 2020. On top of this, many HSE-run hospitals are still charging exorbitant fees in their car parks, with the average cost of car parking for cancer patients at around €62 a week. Despite a programme for government commitment to introduce a cap on hospital car parking charges and to introduce flexible passes where possible, nothing has really changed. The Department of Health has failed to grasp this nettle after years of empty promises. Following a 2018 review of car parking charges, the HSE signed off on a plan to cap car parking charges at €10. The plan was signed off by the HSE Directorate in January 2019, yet many hospitals are still not complying. One hospital, for example, Our Lady of Lourdes in Drogheda, charges up to €25 a day, and there are many others doing similar. In total, this blatant money-making exercise amounts to around €12 million a year in income at HSE-run hospitals. These car parking charges are especially high in urban areas where our 8 designated cancer centres for individual cancer types are located. These centres are located in Dublin, Cork, Waterford, Galway and Limerick. Many of these hospitals, of course, are known as voluntary hospitals. They are public hospitals, but they have the title voluntary hospitals. And they have commercial private car parks which they operate as substantial money spinners and which place a heavy financial burden on patients. For those living outside of these counties, of course, the costs associated with their appointments are even more substantial. When you include travel, parking, food, accommodation, and items such as tolls and car servicing, the average cost is €989 per year. For so many people, this is the final straw. Instead of focusing on their well-being, treatment and recovery, patients are worried about money. They shouldn't be. These extra and unnecessary charges are taking a considerable toll on cancer patients and their families. We cannot stand by and allow them to continue any longer. While this motion is not a silver bullet, it is an important start. We all know that abolishing inpatient charges for cancer patients and placing a cap on car parking charges is the very minimum that must be done. Of course, the only way to fundamentally tackle the considerable financial challenges faced by cancer patients, and indeed all patients, is a system of universal health care based on need and not ability to pay. But without real political leadership and a commitment to radically scaling up implementation of Sláinte Care, we will continue to have to plaster over the cracks in our health service. With the stroke of a pen, Minister, you could change that, or at least your senior minister could, allowing cancer patients the opportunity to focus on their health and not on their mounting debts. It's time to accelerate reform of our health service, to view it as an essential public service and remove the cost barriers for patients. The Social Democrats believe that this motion would be a good place to start, to make our health service more conscious of and more sensitive to the difficult circumstances that patients are in, to make it more empathetic. So, Minister, by removing inpatient charges for cancer patients, by ending the practice of hiring debt collectors, And by capping car parking charges, cancer patients can be relieved of some of the financial worries and concentrate on their energies on getting well. It's the least they deserve and the very least that the government should do. Please support this motion.
Thank you, Laska Herlick. Minister, I don't think there's a family in this country that hasn't been touched in one way or another by cancer. And it's a diagnosis that can send a person and their family into a state of shock and grief and despair. And it is oftentimes the start of a very, very long and difficult journey for everybody involved. But there is that second shock that people never expect, and it comes as a bombshell to them, and that is the shock of the cost of their cancer care. And I think when I talk to people about this, they assume that their care would be covered. They never expect to be hit with these bills. And I think the fact that they are really does our country and our state a disservice, because in Ireland, those who don't have medical cards or private health insurance do have those costs to cover. Okay. And when they're not capable of covering them, that's when the debt collectors can come in. And I don't know if you listened, Minister, there was quite a bit of coverage on News Talk this week, and people were ringing in with their stories of debt collectors knocking on their doors, and the stress and the horror that was putting on them and their families when they're also trying to actually deal with the diagnosis that they've had. And it isn't just limited to parents. When parents or adults get a diagnosis of cancer, of course, a lot of children in our country are diagnosed each year with cancer. And when a child faces cancer within a family, there's a huge cost for that child's family as well. The Irish Cancer Society have estimated that it can cost up to 15,500 in hidden costs for a child with cancer, and that's covering things like parking permits at hospitals, utility bills, and services such as play therapy and counselling. I've spoken to a few charities in my local area, and one of them, the Gavin Glynn Foundation, helps children who travel overseas and their families. And they've actually said that the average monthly cost is approximately 1,300 if your child has cancer. And that's a lot to add on in hidden costs, plus the loss of income, because in many cases carers have to give up their work in order to look after their children. The costs associated with this range from education supports to one-off costs such as wigs and hair pieces. And parents, of course, face additional day-to-day expenses such as food, clothing and mobile data. When parents bring their children overseas, the HSC will cover the cost of the care of the child that goes overseas, but actually the cost for accommodation and all the add-on is not covered by the HSC, and that can cost approximately 15,000 per child, which is a huge amount of money. And then what that does is it forces families to go out and fundraise and set up GoFundMe accounts and to put their energy into getting this money when their energy should be just solely focused on their child that is sick and ensuring that they're getting the care and the love that they want to give them. I too wish Minister Donnelly was here, because I know he is very familiar with the many great charities that we have in Wicklow that deal with cancer services, and this is replicated across the country. But when I've been talking to them this week, I was actually really surprised at the stories I was hearing. In one instance, there was someone who was actually undergoing chemo. He was missing his chemo appointments because he couldn't afford the inpatient costs. Like, that should never, ever happen. You know, finances should not be a barrier to someone getting life-saving medical services. And I do hope that Minister Donnelly reviews this debate and actually takes that on board and goes talking to those particular services, and they will tell him exactly the real life situations being faced by families in Wicklow and across the country. The reality is as well is that this is not going to get better. We are seeing a huge increase in cancer diagnoses since COVID. And a lot of the local supports are still closed or are dealing with the very high-risk patients. And this new wave of cancer diagnosis has been described as another pandemic of late diagnosis cancer patients who will be dealing with even more expensive cancer costs. So, Minister, I'll say to you that the state has a responsibility to preempt this pandemic wave of cancer diagnosis that's coming down the track, and to ensure that combined, people are seeing huge increases in cost of living, and the state has a responsibility to preempt that and to step in now to ensure that those cancer patients and those families who receive this devastating news, that they are supported fully by the state, and that there isn't these hidden costs that are presenting barriers to them accessing their care. Thank you very much.
And let me begin firstly by welcoming a number of advocacy champions for the Irish Cancer Society here: Katie, Pat, Leah, and my own in Dublin Central, Maria Fleming. And Maria's been a great advocate in Dublin Central in terms of holding us all to account, and really value the work that they've done. I'm really proud to welcome them to the Dáil today. The Social Democrats are proud to bring this motion forward, which marks an important week for cancer action and awareness, with this Friday being World Cancer Day. Cancer is inescapable. There is not one person in this house or country who has emerged unscathed from the disease, and its reach is growing. By 2035, there is expected to be a doubling of cancer cases, and an estimated 40% of the European population will face cancer at some point in their lives. At the same time, the number of cancer survivors living through or after cancer treatment is also continuing to increase year on year. At the end of 2019 in Ireland, there were nearly 200,000 patients living after a cancer diagnosis. Personally, I have not received a diagnosis of cancer. I don't think anyone knows what their own reaction would be till they found themselves in that situation. But what struck me from reading the cost of cancer reports from the Irish Cancer Society and hearing from cancer patients and survivors and their advocates is just how much financial concern immediately weighs on a person after receiving a diagnosis. No one's first thought after finding out that they have a cancer diagnosis should be, how can I afford this? This is not just a form of mental arithmetic for self-preservation or distraction. It's not a translation into something more tangible or mundane because the thought of having cancer is too great. It is because that we fail to talk about in society, cancer comes at a great personal cost, not just in terms of health or emotion or quality of life, but in terms of financial impact. The financial impacts are as real as the diagnosis itself. The Irish Cancer Society Cost of Cancer report clearly illustrates not just the new costs associated with cancer, but the reduction of income which has hit simultaneously for people with cancer. Some direct quotes from cancer patients and survivors highlight the devastating impact of the financial burden of cancer to them. Like a bomb went off. It's caused severe stress on us daily, going from 2 excellent long-term full-time careers to social welfare. We even lost our house to the bank, and I've missed appointments as we had no petrol in order to go. But for the generosity of friends, family and neighbours, we would not have been able to provide food for our children. The financial impact after a cancer diagnosis is immediate and it is significant. Further research from the ESRI last year showed that the main reason for people returning to work after a cancer diagnosis was out of financial necessity rather than they felt ready to return. Once again, financial implications are overshadowing what should be decisions made for the benefit of health and well-being. Research published in 2018, specifically looking at colorectal cancer survivors and the associated financial hardship, again supports the research by the Irish Cancer Society. Of 496 respondents, 30% had no savings at the time of diagnosis, and those that did have savings, almost 50% used some or all of their savings. There is not one type of cancer patient. Cancer patients are young people with families, work professionals, people living in rural areas and our cities. Stories of survival are becoming more commonplace, but we know survival is different from thriving. Our previous thinking and priorities when it comes to the cause of cancer, namely dealing with treatment options, life expectancy and survival rates, need to change. We need to be as concerned with the quality of life and the well-being for cancer survivors and the patients as we are about treatment and survival rates. Every aspect of navigating a cancer diagnosis in Ireland comes with a financial cost, from travelling to treatment. People opt for public transport when travelling to and from chemotherapy, despite knowing the nausea they feel because they can't afford the exorbitant car parking fees and worried about how many hours are left in the meter when receiving their radiation therapy. 83% of patients incurred parking costs at an average of €64 per month. Inpatient charges for chemotherapy and radiotherapy at €80 per visit are capped at €800 per year. Not only are these treatments costed, but cancer patients will be chased if they fail or forget to make a payment. After only 47 days and with no clear guidance, hospital can refer the debt to a debt collection agency at a time and when a person is at their most vulnerable. Our motion supports the call from the Irish Cancer Society and seeks to abolish the €80 inpatient charge, which is paid by patients at every chemotherapy or radiotherapy appointment. and stop the indignity of debt collectors being permitted to chase payments from cancer patients, and make the government honour its commitment in the programme for government to introduce a cap to the maximum daily charge for car parking for patients and for visitors at all public hospitals where possible, and introduce flexible passes in all public hospitals for patients and their families. In previous response to a parliamentary question, the Taoiseach last May said about the practice of debt collections being used for unmet hospital payments. He responded, "People have a social obligation to pay their bills and taxes and settle their debts, because if they do not do so, they pass those debts and bills and costs onto society and onto other people." This is a government who not only recognises a moral obligation for people to pay, and not amoral that they fail to provide affordable and accessible services. Politics is about choices. You can choose to be on the side of people who have experienced sickness and illness that they had no choice in, or you can choose to be on the side of those who believe you have to pay your debts regardless. The Social Democrats stand for a society where if you get sick, you get cared for.
Corla. And firstly, I want to thank Deputy Shortall and Murphy and colleagues for raising this, tabling this motion, and I do think it's a really welcome opportunity to discuss what you have set out in the motion. And you are quite right, every 3 minutes somebody gets that call. Unfortunately, we were one of the families that got that call 15 months ago. My husband was diagnosed with cancer, but thankfully he has come through it so far. And I do understand exactly, the issues that you're raising, and I'm actually surprised that we're here alone discussing this. I'll be honest with you. I lost my own dad in 1995 to cancer, and I currently have an uncle having radiotherapy today. So there's not a family in Ireland that hasn't been closely affected, and sometimes some families seem to travel that road a lot, but I don't think there's any family will ever escape it. And I do welcome this debate. Before continuing, Minister Donnelly has asked me to express his thanks to the Irish Cancer Society, who have played such a vital role in helping to transform the experiences and outcomes of people affected by cancer through their tireless work. This includes research such as the Real Cost of Cancer report. I am sure this is something the whole House can agree on. Minister Donnelly looks forward to continuing to work closely with the Society to further develop cancer care services and supports in the years ahead. The opening line section of the motion is sobering, and it highlights the challenges we face today. It is true that around 24,000 people are diagnosed with invasive cancer in Ireland each year, excluding the common but rarely fatal non-melanoma skin cancer. And the reality is that the overall number of cancers diagnosed has continued to increase due to our increasing and ageing population. This underlines the importance of delivering on the National Cancer Strategy 2017 to 2026, with its focus on cancer prevention, diagnosis, treatment and patient supports. The vision of that strategy is that together we will strive to prevent cancer and work to improve the treatment, health and well-being, experiences and outcomes of those living with and beyond cancer. It is about preventing cancer across our population, diagnosing cancer early, providing optimal care to people and maximising their quality of life. The strategy provides a comprehensive 10-year roadmap for cancer services, and we have seen significant progress on its implementation over the past 4 years. Clear, evidence-based policy direction from the Department of Health and strong implementation by the HSE's National Cancer Control Programme has resulted in real improvements across all stages of the cancer continuum. We have the evidence to show that this approach is working. The most recent annual report published by the National Cancer Registry shows that the incidence of cancer per 100,000 people has fallen or at least stabilised in recent years, and survival rates for cancer patients are continuing to improve. 5-year net survival for patients diagnosed during 2014 to 18 averaged 65%, up from 42% from those diagnosed during 1994 and 1999. As the deputies note in their motion, an estimated 200,000 people are living with and beyond cancer in Ireland today, thanks to continued improvements in medical oncology, radiation oncology and surgical oncology services. However, we must recognise that the National Cancer Strategy is not concerned solely with advances in treatment, but also on improving the quality of life for those living with cancer. This is why the establishment and ongoing work of the Cancer Patient Advisory Committee is so important, and why there is also a focus on providing grant funding and best practice guidelines for community cancer support centres and developing survivorship services to support those living with and beyond cancer. And I think of the Solis Centre in Waterford today. Deputy Cullinan would be very familiar with it also, and it absolutely offers great support and services to people living with cancer and going through treatment. Such progress has only been possible thanks to the very significant government investment in cancer services in recent years. Over budgets 21 and 22, some €97 million in additional funding was allocated to cancer services, of which €40 million was allocated specifically for the continued implementation of the National Cancer Strategy, building on the progress and momentum to date. A further €30 million was provided for new cancer drugs, while €12 million was set aside for screening services, and the remainder was used to ensure that cancer services continue to recover from the disruption caused by COVID-19. I think it is important to set out for the House the extent of the government's investment in cancer services in both financial and policy terms, in order to clearly demonstrate our deep commitment to supporting many thousands of people and their families and carers who are living with cancer in Ireland today. Nonetheless, despite the investments in our cancer services, the Minister for Health is acutely aware of the financial difficulties that people can face following a cancer diagnosis. It is true that cancer can place a financial burden on some individuals and their families through the combined impact of loss of income and additional costs associated with their treatment. This issue is not confined to cancer patients, and individuals diagnosed with other long-term illnesses may also have to cope with financial stresses as a result of being unwell. It is for this reason that support to ameliorate the costs of illness should be available to all, rather than focused on those with particular conditions. This is the principle behind the transition to universal healthcare envisaged by Sláintecare, where people access the right services based on need and not ability to pay. In relation to inpatient health charges, under the Health Act 1970 as amended, all persons, irrespective of illness or condition, accessing public inpatient, including day case service in a public hospital, are liable for the statutory inpatient daily charge, which is capped at a maximum of €800 in any period of 12 consecutive months. There are, however, exemptions from these charges for identified groups of people, including but not limited to people with full eligibility, that is, medical card holders. As is the case for all patients, cancer patients can apply for a range of supports, including medical cards, and they are assessed under the criteria applying to all applicants. Every effort is made by the HSE within the framework of the legislation to support applicants in applying for a medical card, and in particular to take full account of the difficult circumstances in the case of applicants who may be in excess of the income guidelines. Indeed, the Irish Cancer Society found that over 80% of those diagnosed with cancer who apply for a medical card are successful, while medical cards are awarded without a financial assessment to all children under 18 years of age with a diagnosis of cancer for a period of 5 years. Individuals with a terminal illness who have been certified by their treating consultant as having a prognosis of 24 months or less to live are also now eligible for a medical card without a means assessment, and I know everybody has welcomed that. Beyond this, the HSE has discretion to reduce or waive inpatient charges in cases of excessive hardship, while in certain circumstances the HSE may grant a medical card even though an applicant exceeds the income threshold, where they face difficult financial circumstances such as extra costs arising from an illness. Of course, further supports are available to individuals, including those provided by the Department of Social Protection. All patients require a responsive and compassionate health system to meet their medical needs. I believe that is the underlying intent of the Deputy's motion, and it is why the Government is continuing to work towards the terms of delivering an affordable, accessible and quality health service for all. As such, the Government does not intend to table a counter-motion. My colleague Minister Rabbitt will discuss progress being made on affordability later in the debate, as well as addressing some of the other issues raised by the deputies in the motion. Garv Mahagut.
Anisha Rashford, the Social Democrats, Dr. Keane O'Callaghan.
Garv Mahagut, Lascar Corla, and firstly I want to thank my colleague Roisin Turthall for bringing forward this motion, and I want to thank the Irish Cancer Society for all the work that they've done on advocating on this and highlighting this. It is welcome that the Government isn't tabling a counter-motion on this, so the Government is going to support our motion. But simply supporting it and not tabling a counter motion isn't enough. We need action on the motion. And I haven't heard from the Minister that there will be any action on the motion. In fact, I've heard from the Minister just there in her most recent comments a defence really of the status quo, which simply is not good enough. It is not listening to cancer patients on this and listening and seeing the difficulties and the stresses that they're going through. Our motion calls for an abolition of the €80 inpatient charge for all those receiving cancer treatment. So what is the government's position on that? Are you going to, if you're passing this motion, when are you going to abolish that €80 inpatient charge? Our motion specifically calls to direct the HSE to end the practice of using debt collectors. There's no mention from the Minister on that. Totally unacceptable practice at all. And we haven't had a commitment from the Minister in terms of the car parking charges, which places a huge burden on people at the very time when they don't need it. So it is welcome that the government isn't opposing this motion, but for that to mean anything, we actually need action from the government. We need commitments from the government. We need timescales on this, and not a simple defence of the status quo. That is not going to cut it. This motion, Last Count Corla, is about seeing people and seeing the stress and the trauma that they are going through when they receive a diagnosis, and seeing the huge burden that these financial charges place on top of them at the very time that they don't need it, at the very time that they are trying to deal with their diagnosis and deal with their treatment. And I don't think, actually, and I appreciate there is empathy on this, but I don't think that has actually been heard fully by the government. Because if it has been heard fully, then we would be hearing the actions that you're going to do to address this. You'd be hearing about when you're going to abolish the charges, when you're going to call off the debt collectors. And we should pause for 1 minute and ask ourselves, how did we get to a situation as a country and as a people that we're sending debt collectors after people with cancer diagnosis at the very time that they're at their most vulnerable, at the very time that they need the most support from this state and from this country, that's the way that they're being treated. I don't believe there's a single TD in this Dáil that supports that. I don't think anyone in this country supports that. But that isn't enough. We have to change that into action and stop this terrible, inhumane practice, this brutal treatment of people, which cannot be defended and hasn't been defended in the Minister's comments. But we have to actually act to make a change on that. Last Count Corla, I want to just read you just one quote from the Irish Cancer Society on this. And they say, when thinking about cancer, people tend to focus on the treatment options and chances of surviving the disease, not the families right across the country crushed by debt, struggling to make ends meet and facing an uncertain financial future. Not a parent having to make the choice between paying for medication for themselves and putting food on the table for their children. Not the debt collectors working on behalf of hospitals, chasing cancer patients at their lowest physical and emotional point. Not those sitting in a cold house during chemo because the heating bills are just too high. And that's the reality that people are being put into now by the state, and the lack of action on this. The hospital parking charges, which have been referenced, are a huge extra cost and burden. Just want to quote from one cancer patient on this. They say, I quote, "I stayed in hospital for 115 days, and during that time, my wife Trish came to visit me 5 days a week. It cost her almost €1,200 in parking charges alone in that time. If she was able to get free parking, or even at a reduced rate, it would have been a great help to us." A wife visiting her husband in hospital with cancer being charged €1,200. That's inhumane. That needs to change, and we need action from the government on it.
Thank you, Cahirlock. Minister, 1 in 2 people will develop cancer during their lifetime. Getting a cancer diagnosis is overwhelming and it is terrifying. Many, or most, if not all of us, have lost loved ones to cancer, but we also know many people who have survived. Screenings, improved treatment, and excellent care are all increasing survival rates. However, this comes at a deep physical, emotional, and disgracefully a financial cost. This financial cost is callous and it is uncaring. Not only are cancer patients charged for their care, hospitals use debt collectors to pursue individuals and families dealing with the turmoil and toll of cancer. Patients without a medical card or private health insurance are charged for inpatient treatment, including life-saving chemotherapy and radiotherapy at a cost of €80 per visit. Then there are the numerous other costs, from medication and counselling to childcare, wigs and heating and outrageous parking fees in hospitals. The Irish Cancer Society estimates that the average cost to someone diagnosed with cancer is €756 a month, but can be over 1,000 in some cases, while at the same time, people are faced with a loss in income of over €1,500 a month on average. The Minister and the HSE know all of this. The inadequacy of the response to the lived reality of cancer patients and survivors is truly staggering. This awful and terrifying disease is made even worse by government health policy. This has to stop, and it can stop today. In the words of a constituent who contacted me on Monday, the cost of cancer is disgraceful, and it's when you're at your most vulnerable. The government should support our motion to provide relief and support for the thousands of people who are currently undergoing treatment and the thousands more who will be into the future. Abolish the €80 inpatient charge, direct the HSE to end the practice of using debt collectors, honour the programme for government commitment to cap daily charges for car parking at public hospitals, and introduce flexible passes for patients and their families. The constituent describing the impact of the cost of cancer care outlined how his medical bills skyrocketed as he had to pay for medicines, pain relief, GP bills, and much more. He eventually got a medical card after months of wrangling and, as he described it, fighting with the HSE. The state doesn't need to make cancer even more difficult for people and their families. Cancer support services are also desperately underfunded. I very recently visited Cork Arc House in Bantry, which provides a range of support and care for people diagnosed with cancer and for their families, from vital information and advice to counselling, wigs, art therapy for children to practical supports. In 2001, they had over 1,500 active users, up from 1,200 in 2020, and they provided over 10,000 services. Disgracefully, truly disgracefully, Cork Arc Cancer Support House receives only $45,000 annually in HSE funding towards the centres in Cork City and in West Cork. That represents just 5% of their overall income, the rest of which is fundraised. This is an incredible service which makes an immeasurable difference in the lives of cancer patients and their families during and after treatment, yet they receive only 5% of income from the HSE. They're rightly seeking an increase in funding to ensure that their services can expand and continue to meet the ever-increasing demand. Cancer can have a long-term cost and life-altering impacts which patients too often have to pay for. This week I was contacted by a young woman who had to have a hand amputated due to cancer. She quickly realised that public-funded healthcare and support falls so far short of what is required. Minister, she doesn't qualify for a primary medical certificate to allow her to purchase and adapt a car because she had one hand amputated rather than the criteria of two hands. She's forced into getting and adapting a car herself to allow her to return to work and to care for her child. In addition, the public cover of prosthetics in Ireland is the worst in Europe. She will need 3 prostheses in her first year, and the public system only covers 1. The cost is shocking for this woman who wants to recover, get back to work and live a full life. However, the cost of cancer care is a government choice. There isn't a person in Ireland who isn't affected by cancer. there isn't a person in Ireland who would oppose reducing the cost of care. So why would the government? Minister, I would sincerely hope that the government will go further than not proposing a counter motion today.
Thank you. Deputy Cullinan, please, you have 20 minutes to share your slot.
I am, yeah, a number of my colleagues. I have 8 minutes myself, so you might just alert me when the 8 minutes are up. And can I first of all thank the Social Democrats and Dr. Shortall for bringing forward this important motion this morning. Obviously, Sinn Féin will be supporting this motion, and we will continue to advocate for the removal of hospital inpatient charges, car parking charges and other taxes on being sick on a phased basis, balancing medical and financial need. My party, Minister, believes in a single-tier universal healthcare system which delivers care where and when it is needed on the basis of need and not on the ability to pay. I'll deal with the substantial issues raised in this motion in one moment, but I think it is important for us to reflect in the wider context of where we are in our healthcare system and fundamental promises that were made by the political system of which we all signed up in the form of Care. We have not at all addressed the issues of reducing the cost of healthcare to any great satisfaction. We have not moved in any great regard on delivering universal primary care, starting with universal GP care. It's moving at a snail's pace, and even what was provided in the budget for 6 and 7 year olds is still not in place because of ongoing talks with the IMO and GPs. We have a real crisis in GP capacity, and there are lots of issues which need to be sorted that the government haven't even started on, which is looking at demographics and demand and so on in the context of capacity. We haven't moved on decoupling private medicine from public hospitals, and we haven't moved substantially on waiting lists. We're seeing them go up. So despite the big promise that was made for all patients, including cancer patients, that we would deliver a better healthcare system, and I know we have, of course, been through a pandemic over the last number of years, we have not made the strides forward that we need to make. And that's not even to get into issues like regionalisation and other issues which are important to the delivery of the reforms which are necessary. From my perspective, Minister, no patient, but especially someone with a terminal cancer diagnosis, should be hounded, threatened and terrified by debt collectors. I'm sure that you and other colleagues in this House have seen some of the letters that got sent to patients by debt collectors. They are nothing short of intimidation and put additional stress on patients who may already have financial difficulties and who are already dealing with the stress of cancer. And the HSE spends nearly $4.5 million on debt collectors every year. And that sounds like the furthest thing from a health system which is supposed to be moving to a universal healthcare model. We have to end this practice, particularly for those patients with cancer and chronic conditions. A cancer diagnosis is a life-altering event. Nearly 1 in 2 people will develop cancer during their life. The rate of cancer is equivalent to someone being diagnosed in this state every 3 minutes. Every year, someone dies from cancer. Cancers are the leading cause of death, with nearly 1 in 3 deaths linked to cancer each year. Cancer is therefore a massive burden on the individual and their family, and also on the wider community and society. It is something we experience collectively, and something we all experience either personally or through someone we love. As the Minister knows, a cancer diagnosis can be devastating physically, mentally and emotionally, but also financially for the person who has cancer, but also for the wider family as well. Thousands of cancer patients face into a financial burden in the region of €700 to €800 a month, nearly €10,000 a year. At the same time, many are left out of work or on reduced hours. The average household can lose out on €18,000 a year, which can absolutely devastate any household at the wrong moment. And obviously low-income households are particularly vulnerable. If you take any family dealing with a cancer diagnosis and the additional stress of its associated financial costs, how could you justify setting a debt collector on them and tolerate the sending of threatening letters in an attempt to recoup a small amount of money, at most a couple of €100, from a family which is already struggling with so much? Given its prevalence and potential severity, it is only right that beating cancer and supporting people with cancer is a top priority for us individually, for the political system and for the wider health system. I appreciate as well that in recent years, in the last couple of budgets, additional funding was made available for the National Cancer Strategy, and I commended the Minister for Health in putting forward additional spend, but there are still a lot of the key performance indicators in that National Cancer Strategy that have not been met, which have not been implemented, and will require further resourcing and support over the next number of years. So there is a lot more work to do, particularly to catch up on the pandemic backlog and the cancers missed over the last 2 years, and in delivering top-class cancer treatments which are available to private patients in this state, but also to public patients through a model similar to Britain, the National Health Service. Unfortunately, in this state, while cancer services, thanks to the efforts of the medical and healthcare professionals in that field, remain one of the better performing parts of the healthcare service, there is still, as I said, a lot of progress to be made. In particular, access to innovative new treatments must be expanded, as well as access to therapeutic clinical trials. The cancer strategy set a target of 6% on clinical trials, yet still only around 3% of cancer patients have access to such trials. In a recent meeting I had with the Working Group for an All-Ireland Cancer Research Institute, cancer researchers stressed the need to reach and beat that target. Medics want it, patients want it, research needs it. In England, and I was told by this group, that up to 1 in 5 cancer patients have access to clinical trials. Access to all clinical trials. Denmark provides access to nearly 3 times more than we do. For all patients, but particularly those with severe and complex cancers, we must do better at attracting clinical trials and enabling patients to access them. This is something that can be done on an all-island basis to maximise access and trial availability. It is something which patient advocates on both sides of the border have been calling for. Wealth should not determine a cancer outcome, or any health outcome for that matter, but as we know, it does. Despite the investments under the cancer strategy to date, access to life-changing treatment for some severe cancers remains restricted and only accessible to private patients. A public patient seeking access to immunotherapy to prevent the recurrence of melanoma, as an example, with the same condition as a private patient, faces a constrained system where the first option is often restricted to watch and wait. We have a huge problem as well in the public system with diagnostics, and I certainly would want to see, rather than more outsourcing and giving more money to private sector to do more diagnostics, we need more investment in community diagnostics to properly equip GPs to be able to access diagnostics more. We have got into a habit, because of maybe the ideology of the parties in government, of outsourcing everything, outsourcing diagnostics, outsourcing treatment to the private sector, outsourcing the hiring of staff, rather than properly investing in the public system, which we need to do. So again, I thank my colleagues in the Social Democrats for tabling this motion and for again putting a very important issue of cancer on the political agenda. Thank you.
Thank you, Deputy O'Leary.
Minister, you're probably familiar with the programme Breaking Bad, and what you might recall, I don't know, you might have seen around the time that was, I suppose, coming out, there was a meme doing the rounds, and it was Breaking Bad UK edition, and it went like that. Walter was diagnosed with incurable lung cancer, and he's asking, "This will bankrupt me. How am I going to pay for my bills?" And the doctor replies, "Well, the government will pay for your bills. What kind of barbaric society would allow a person's health to hinge on their wealth?" Now, while we might not have a system quite as invidious and unequal, and in some respects quite vicious as the American healthcare system, depriving people of their livelihoods and their prosperity, our system isn't too hot either. And I think this motion, and I welcome it being proposed by Social Democrats, very clearly reflects the fact that there is a huge impact on people's income because they have a diagnosis of cancer. And that is completely wrong. This is one of the most stressful, worrying, frightening times of a person's lives. Very often they're out of work, their income is hugely affected, their quality of life, the quality of life of their family is hugely affected, and at the same time they have to deal with the impact of all the additional costs, and indeed the prospect, if they cannot afford to pay them, of debt collectors coming to pursue them. That is absolutely unacceptable. And in some ways, maybe that isn't so far from that US model that is so invidious. Cancer patients are charged €80 per inpatient visit. A lot of them would have to attend hospital 10 times or more a year, very frequently, charged at €800, some as high as €1,000. This motion is seeking to abolish that €80 charge, something that we agree with. You can throw in on top of that your parking, food, all the rest of it. One other issue I want to raise, just that has come through our office, is just in relation to the primary medical source for cancer patients, an issue that has come to light recently, and I think it was a very radical decision by that board, and it clearly illustrated the frustration that they felt. We had a constituent who came in contact with us. She had to have her arm amputated because she was diagnosed with clear cell sarcoma. She needs to adapt her car to allow her independence. That's vitally important to her quality of life, and her independence. She doesn't qualify for the primary medical cert because she only has one arm amputated, not both. Now that is absurd. That is disgusting in my view. On top of this, Ireland is the only country in Europe that doesn't cover prosthetics for people who require them. This woman will require 3 prostheses in the shape of her arm throughout the year. She's only covered for 1 prosthetic from CUH, and her health covers for up to insurance covers up to €2,000 per annum. That won't come near the cost of 1, let alone 2 prostheses. So, that is just one other example of the impact our healthcare system. Look, the example I gave and that meme, the NHS, it's not perfect, but it is a system that is based on the public good, and that is what we need to work towards. We need an Irish National Healthcare Service that is available free at the point of access. That doesn't mean that people are deprived care or delayed care or broken financially because they fall sick. What kind of, as the meme said, what kind of barbaric society would allow a person's healthcare to hinge on their wealth? We aren't in the same way as the United States, there's no question of that, but we have a long, long way to go to have a healthcare system that is fair, humane, and doesn't ensure that wealth is the key determinant as to how healthy you are.
Thank you. Deputy O'Rourke. Oh, sorry, Deputy Coulds, excuse me. You weren't in my field of vision. Sorry.
Yeah, like the rest of the Sinn Féin speakers, I want to thank the Social Democrats for bringing forward this very important motion. Diagnosis of cancer is absolutely devastating for an individual and for their family. It is a shock to the system. It is completely unacceptable that in the midst of this upset, fear, anger and sickness, that the HSE are sending debt collectors letters to people. The HSE has spent over €4 million on these debt collecting agencies for cancer patients since 2013. This is a shameful indictment of the treatment of cancer patients in the state. We often look to America and their healthcare system. Now, obviously, our system is much better and caring than those, but for these cancer patients, it's not. For these cancer patients, receiving debt collectors agencies while in the midst of chemotherapy for cancer is completely unacceptable. The HSE give people 37 days before the debt collectors contact them. That's less than 6 weeks after admission to hospital, and these debt collecting agencies are knocking on their doors. And for some people, €800 is not small money. There are so many hidden costs to when a person gets a cancer diagnosis. Time off work, for them, for their families, transport, medicine, for some people, wigs, because of the effects of chemotherapy. For some people, a bill of €800 arriving to their door is not affordable, but it also is like a dagger on top of everything when you're struggling, when you're at your most vulnerable, that you have people looking, a debt collection agency at your door. And what it does is it completely undermines the individual that on top of this terrible illness, that the cost on them and their family. So there's the human side of this. It's wrong and it must stop. I just want to take the opportunity to briefly raise the delay in care of cancer treatment during COVID-19. A neighbour of mine, a friend of mine, his wife contacted me last week to say that her husband was very sick last August, September, had to wait 2 months for a scan. That scan revealed a tumour in his brain, which required emergency operation. Up to the weekend, that operation, they were waiting for contact for it to be done. Now, it's a tumour on the brain, a delay because of COVID-19 for access to scanning, a delay because of COVID-19 for access to emergency surgery. And the opposition have been highlighting since the start of the pandemic the importance that that cancer patients and other seriously ill people couldn't fall through the cracks because of COVID. But obviously this man, Tom, and my thoughts and prayers go to him and his family for what they're going through at the moment. And coupled with this then, what you have is, I suppose, the weight of the family, and then to receive a bill and have debt collectors chasing you down. And the other side of this then is car parking charges.
Deputy?
Just the point I want to make is, having to go to the hospital then and to pay car parking charges for when you're going in for chemotherapy, surgery or clinics, to be honest, Minister, that has to change, it has to stop.
Thank you, Deputy Morcou.
Sir O'Mega, here, look, I'd also like to thank the Social Democrats for bringing this forward. I think everyone across this House would be in agreement from a human point of view in relation to where we need to get to, and that we're not necessarily starting from where we want to. Plenty has been said already in relation to the fact that we need to properly move to sláinte care. We need a universal healthcare system, and it's free at the point of entry, and it's cradled to death, and it's all those statements that we make from time to time that can seem somewhat trite, but really it's about a decent health system that works for our people out there. We will just pick any points that have been made in the last while. We talk about the medical card. The fact is, we've all engaged in issues where somebody didn't get a medical card as of a right, suffering from cancer, and like we played a game, we go through the effort, we will try to get it one way or another, and eventually we end up in that situation because it's very hard to refuse someone in those sets of circumstances. But it's a whole rigmarole that isn't necessary, that doesn't make sense, and just puts further hassle, further effort on a family who are going through something that's really, really difficult, and where the patient's concentration should be on delivering their health and getting through what is, as I said, an incredibly difficult process if we're talking about radiation treatment or we're talking about chemo. And look, it goes without saying, I think everybody's in agreement. Look, the debt collection stuff just has to stop. It's utterly wrong. As I said, people under pressure to just have that sort of communication or interaction for what is very small money, some of which shouldn't even be debts that accrue at all. That's a point we need to get to. In fairness to Deputy Gould at the end, he was trying to get that issue of car parking. I think that goes without saying that, right, for a lot of us, it's a nuisance. You land at the hospital and you have to go and you find your change or your card or whatever, and it can be here relatively expensive, but for a one-off, that's people will live with it, for the want of a better term. But people who are going through consistent, constant, day by day or week by week treatment, it's not okay that this extra cost is put on them. And I know there is the added issue in relation to some of these are private car parks, but I don't think it's beyond the realm of government. I don't think it's beyond the ability of government to find a solution to this problem, because it's far better than us making political points in relation to it, that it's just taken off the agenda and it's just delivered upon. Look, we all know of people who've been suffering from cancer, who've dealing with it, even friends of mine in the last while, and some unfortunately who have passed since, and they got the absolute best of care. But there are difficulties. We do need to look at the systems that we operate, in the sense of there's people who sometimes the family arrange to bring the person up for treatment, and then all of a sudden, oh no, that was cancelled and the communication's imperfect. And some of that is because the database systems and the systems that we have between doctor, between patient, between administrator just isn't perfect. And I know there are difficulties in relation to that, but that's just something that just needs rectified as soon as possible, because it's costing time, it's causing pain, and in some cases it's probably having really, really bad ripple effects that need to be taken into account. Look, there's a number of simple asks here that just need done so we have better cancer care for our people.
Thank you, Deputy Duncan Smith.
Chair, I'd like to thank Deputy Shortall and the Social Democrats for bringing this motion. It's an excellent motion that crystallises very clearly the problems in terms of the cost of cancer care. We've been speaking a lot in this country over the last number of weeks and months about the cost of living. I think what this motion speaks to quite dramatically is the cost of trying to stay alive. When people are diagnosed with cancer, their first thoughts should be about their treatment, the impact on themselves, their families, their loved ones, their friends, and the journey ahead. But for many, the first thoughts, or one of the first thoughts, is about, can I afford this treatment? And these majority of people who are suffering with cancer are going through the public system. And this is where these costs are being incurred. They're not being incurred through elective treatment options. This is what the public system is costing people who have cancer to pay. And the research from the Irish Cancer Society is absolutely excellent and is so clear and paints a very vivid picture of the challenges that these people and families face. Because the costs are one thing, and we'll talk about the costs in a moment, and they've been well laid out by previous speakers. But the people who are facing into cancer aren't facing those costs with their income remaining static from prior to their diagnosis. Because the average drop in income for cancer patients was €1,500 a month, according to a survey of the Irish Cancer Society, or €18,000 a year. So not only are they facing increased costs, they're facing a dramatic decrease in their income due to inability to work or reasons related to their cancer. So it's a double whammy that really impacts households at their most vulnerable time, impacts people at their most vulnerable time, having to afford these vital, much needed treatments and costs that are associated with that at a time when your income has been decimated as well. The issue in relation to debt collection is something that just has to change. I mean, it has to be unequivocal from government. I mean, we had a response to a parliamentary question up to 2020, setting out year on year the figures. And it starts at 439,000 in 2013, then it goes up to 532,000, 567, 585. In 2017, it was 603,000. It goes back to 573,000. Then 2018, 687,000 being spent on debt collectors. The year to date in September to September 2020 was 386,000. They're the latest figures I have, but 2020 was obviously on course to go well above 500,000 as well. So 4.3 million of HSE money going to debt collectors who are and the HSE are invoking their National Financial Regulation NF425 to set out that if a patient hasn't paid an invoice within 40 days of it being issued, that they get a notice to refer to a debt collection agency within 1 week after that. So 6 to 7 weeks after an unpaid invoice has been sent to a debt collection. I mean, we've dealt with constituents that have utility bills unpaid that take longer to get to a debt collection if they haven't paid for a Sky Sports subscription or something. And we're talking, but this is 6 to 7 weeks if you are haven't paid an invoice in relation to cancer treatment or another health treatment. It's immoral and it has to stop. And again, I referenced it last week in relation to, I think it was the Sinn Féin motion, which the government weren't opposing, that not opposing a motion or not putting down a counter motion is not the same as supporting it or actually acting on any of the recommendations. I'm sure the proposers of the motion would accept at least some progress on at least one or two or three of the asks within it. But what we had, unfortunately, from the Minister was just a setting out of the status quo, and that's simply not good enough. Tea and sympathy is not what's required. We have very real costs here. The €80 inpatient charge has to end. The car parking charges have to end. There are some hospitals we know that have reduced or frozen for free car park charges. They're the exception rather than the rule, but they're operating without a national policy in relation to it. Minister Simon Harris in 2018 implemented a report on car parking charges. It was finalised in 2018 and it has not yet been published. That is incredible. It's a report on car parking charges and it's taken 3+ years and hasn't been published yet. I mean, there's no excuse for that, except intransigence and a willingness not to actually tackle what many would consider reasonably low-hanging fruit in this, in terms of reducing costs for people with cancer care. And I know that some of the car parks are private and that may force some complications, but it's not insurmountable. And it's another example of the privatisation by creep of our health service over the years, including outsourcing the provision of car parking to private companies. And once it's there, it's like, well, look, that's there. We don't have a responsibility for that. We should have responsibility for that. It is vital, as was articulated by Deputy O'Callaghan earlier, a wife visiting her husband who's getting cancer treatment, and the costs of over €1,000 just for car parking. I mean, it's something that we can't stand over, that our health service can't stand over in any way, that the HSE can't stand over in any way whatsoever. But the figures have been well laid out. We have the inpatient charge, we have the additional bills at home. I mean, we have additional heating and electricity and telecom bills for people who are dealing with therapies, recovering from therapies at home. And we don't need to go down the road again as to where our utility bill charges are, and our gas bills and electricity bills. They are absolutely outrageous, and opposition have put forward practical proposals to reduce them. But again, as I set out at the start of my contribution, when your income's been reduced by €1,500 on average a month, and your costs are being increased across a whole range of areas, just because you have been unlucky to be the 1 in 2 people that's going to be impacted with a cancer diagnosis. If we are to have a health service that we're proud of, these are the areas that we need to tackle, and we need to tackle quickly. I think it's a wonderful motion. I think it has really clear asks. If all of them can't be delivered as soon as possible, I think this government could have made a better contribution in terms of at least making some progress along 1 or 2 of them. Unfortunately, we haven't got that, and we will have tea and sympathy from government rather than real change on this, and that's disappointing. Thank you.
Okay, Deputy Smith. It's next speaker is Deputy Kenny. You're sharing your time. Deputy Murphy.
Thanks, Chair. And I'd like to commend the Social Democrats on this very, very, very good motion. It can actually breaks the kind of it down in relation to stealth charges that people are getting in relation to one of the most traumatic times of their life. And it's good to see people in the public gallery for the first time in a long time. So it's good to see that. That obviously warms everybody's hearts here. And Minister, the charges are stark, very, very stark indeed. And I'm not sure if any member of the government could justify these costs in relation to somebody that's going through a cancer diagnosis. And the list goes on between, day charges, car park charges, and so forth. And I received a letter in the last number of days from a constituent. And I'll just read some of it out. And this lady was going through chemotherapy at the time. And during the chemotherapy, she got a letter from a debt collector that, they were saying that she owed a certain amount of money, and they wanted that money as soon as possible. Now, if you want to kind of live in a very civilised country, you can't call yourself a civilized country if you're chasing down people in the middle of chemotherapy for charges of a public service. It's literally ludicrous. I don't know who makes this stuff up. And you know, when you think in context, and I try not to personalise anything when it comes to politics or anything else. Paul Reid earns 420,000 euros a year. That's 10 times the amount of a nurse. Now, you can't justify that. I don't care if Paul Reid speaks 20 languages. He does not justify that amount of money. It's an incredible amount of money. And while nurses and that lady in the Dublin Midwest and other people that are going through similar situations have to pay these costs. So it's kind of ludicrous in a situation that we have. And when you really break it down, as I said, in the middle of a diagnosis, somebody that's going through a very, very stressful time in their life, they have costs where they can't work because of the diagnosis. And now what has happened is that they have extra costs. Now, if somebody can justify that, I'd like to hear their response in relation to somebody that is going through that diagnosis and that situation. Minister, you couldn't justify that. I know that. I'm actually curious for your response in relation to somebody in that situation. And I'm very, very kind of, I'm very curious of your response. Thank you.
Murphy.
And thanks a lot to the Social Democrats for bringing forward this motion, which highlights more aspects of the dysfunctional two-tier health system that exists in a permanent state of crisis. And the problems in healthcare on this island are not accidental, they're not personnel, they are structural problems. They're consequences of years of underfunding of our public health system, of cuts, of privatisation from below, and of neoliberal management. And that neoliberal management seeks every opportunity, and it's demonstrated by the debate today, every opportunity to extract money from people, even from something as essential as healthcare needs, through the application of charges for treatment, the charges for parking in hospitals. And then to add insult to injury, debt collectors are brought in on the act to extract their cut from ordinary people's requirement for healthcare. We called in our budget statement for the abolition of all inpatient and emergency department charges for public patients. The estimated cost from a PQ for that is 20 million euros as part of our proposals for a universal, single-tier, national health service free at the point of use, funded by progressive taxation. The removal of charges is also a Sláintecare recommendation, but the charges nonetheless remain. Deeply regressive, morally bankrupt, they should go. But the HSE doubles down on the inequity of these charges, with patients pursued by debt collectors for unpaid charges. Rachel Murrow, the Director of Advocacy and External Affairs at the Irish Cancer Society, recently said, "The Irish Cancer Society has heard from patients about the distress and anxiety that contact from a debt collection agency chasing payment for hospital charges brings, understandably so. The worries and fears that are naturally brought on by our cancer diagnosis are compounded by this practice, and we want it to end." An Irish Examiner report in December told of Jean Coghlan, who was diagnosed at 48 with breast cancer. She said a death letter followed her out of the hospital after her surgery to remove a tumour. Quote, "As soon as I went home, the bill followed you out from the hospital. Whatever it was, 2-3 nights I stayed. They billed me up to 240 euros in inpatient charges. As a newly diagnosed cancer patient, you're so angry and your entire existence is all over the place and you have people chasing you for money. Scandalous." We also learned from the Irish Independent recently that the HSE spent more than 568,000 euros on debt collectors to pursue patients for unpaid hospital bills during the pandemic. Charges for hospital care are regressive, they're immoral, the HSE must immediately end the use of debt collection agencies to pursue outstanding charges, and all related debts should be cancelled. I also want to refer to the issue of...
Speaking, please either go outside and have your conversation or be quiet. There's a deputy in possession and you're interrupting. Deputy Murphy, please.
Thanks, Chair. I also want to refer to the issue of parking charges, where it's over 3 years since a €10 per day cap on parking at hospitals was promised. Fianna Fáil went further, they promised free parking, but this regressive tax on ordinary people, on sick people's relatives and friends, faced with inadequate public transport infrastructure, remains in place. According to the Irish Independent, in early January, the HSE generates €12 million per annum from car parking charges. It can be €15 a day in James's and the Mater, in $14.50 at St Vincent's. Hospital parking charges were abolished in recent years in Scotland and Wales, and they should be abolished here. It is time for the government to stop charging for essential healthcare, to stop charging for transport to access to it, to stop harassing cancer patients and others with debt collectors. They have more than enough to be dealing with. So we support the motion and thank the Social Democrats for bringing it forward.
Thank you. Now call the regional group. Deputy Tobin up. Deputy Canny, you have an 8-minute slot. You're sharing it equally, I assume?
4 yeah.
Thank you.
Thank you very much. And Minister, I'm glad you're here to hear what I'm going to say, because it is all to do with our own part of the world. And I know that I'm speaking to the converted. The probability of receiving a timely diagnosis of cancer and surviving the disease differs substantially across Europe. And because of the major inequity in the access to cancer diagnostics and treatments, the chances of surviving cancer are reduced in the west of Ireland relative to the rest of the country and the rest of Europe. That's a fact. The Celtic Cancer Centre, based in the Model 4 Hospital at Galway University Hospital, delivers a programme of cancer care to an overall catchment of approximately 1 million people across the Celtic group. It includes Connacht and Donegal, with substantial numbers from the Clare, Tipperary, Limerick and the Midlands, including Longford, Offaly, Westmeath. The Celtic region consists of some of the most rural and deprived areas nationally associated with the Western Seaboard. Celtic has a larger, older population compared to the national population. Cancer is a leading cause of premature mortality in the Celtic group, and according to the National Cancer Register of Ireland, cancer patients from this region have the worst cancer outcomes in Ireland. In addition, with the impact of COVID-19, the mortality rate is estimated to increase by 20%. Due to the delayed diagnosis and the lack of access, implying that more patients will die from cancer than from COVID-19. Cancer services in the Celtic group are working at full capacity and beyond, with no resilience within the cancer programme to deliver a safe, staffed and sustainable service prior to COVID-19. And whilst Ireland has introduced a national cancer control programme in 2006 and designated 8 cancer centres, the cancer programme for the West has not received any infrastructure support over the last 12 years and has not been able to develop into a sustainable, staffed, secure programme. The lack of resilience within the cancer programme can be strongly linked to what is described as a serial of underinvestment in infrastructure for the development of services in the cancer in the UCHG and or UHG and also in the other level 3 hospitals in the region. A review of the National Service Plan historical capital expenditure 2017 to 2021 demonstrates that only 7% of the national infrastructure investment was allocated to CELTA. The 2019 KPMG options appraisal for GUH highlighted serious deficits in cancer infrastructure at GUH and specifically identified critical interim developments that need immediate investment, as those buildings were classified as unacceptable in their present condition. KPMG recommended that the ambulatory cancer care centre be progressed as a matter of urgency. The case for investment in cancer infrastructure is self-evident and requires fast tracking and urgent action to optimise and improve outcomes for our population. However, it does not go far enough, as COVID-19 has exposed other infrastructural deficits at Galway University Hospital, in the form of the lack of inpatient beds, dedicated cancer theatres and ICU capacity, and deficits in infrastructure in our level 3 hospitals across the Sálto region. A person with cancer in the west of Ireland should expect the same outcome as any other patient in Ireland or Europe. But in the absence of the required infrastructure to develop the cancer care programme, this is not possible regardless of what efficiencies are put in place in the hospitals. We need to ensure that the patients in the west of Ireland have an equitable chance of early diagnosis and appropriate and timely access to the comprehensive cancer care programme and the Cancer Centre for Complex Therapies, including surgery and radiotherapy. The National Development Plan has it there. They are words, they need to be actioned immediately. Thank you.
Good morning. You have cancer is probably one of the worst sentences that any person is going to hear in the health service. One of the next worst sentences that anybody will hear in the health service is, do you have private insurance or do you have public insurance? If you have private insurance, you're likely to get an appointment in the next fortnight for the condition that you have. But if you've just public, you're likely to be put into a lottery and you never know when you're actually going to be got to. And the nuts thing is, it's actually typically the same doctor, it's typically the same hospital and the same treatment that's actually received by both. It's just one is prioritised and the other is deprioritised. A scandal emerged in 2019 when the VHI said that it will be offering new drugs to its members for the treatment of advanced melanoma, breast cancer and lung cancer. Professor John Crown at the time kicked up a serious fuss because this was the first time that the state was going to allow for private patients to receive a cancer drug but refuse it from public patients. Professor Crown quite poignantly publicly asked the government what was he to say the next day in his clinic to breast cancer patients who were in the public system that they couldn't have this particular drug. In the week that the scandal broke, my office was contacted by a woman who was suffering from stage 3 breast cancer. She was receiving therapy and treatment in a hospital. She developed an allergy to a certain drug, and as a result, she was left in limbo without treatment for some time. And you can imagine her family were deeply upset on the news that the alternative drug was available in another hospital up the road, but wasn't available to that young mother in the public hospital that she was in. Now, we need to fought hard for that woman, and thank God that woman is in remission. But we need to know, has that come to an end? Are there treatments available to some citizens and not available to other citizens in this state? And if you look at the facts of the matter, they're actually quite incredible. There's a 12% differential in the survival rates for breast cancer in the public versus private system. So if 100 women are diagnosed with breast cancer in a private hospital, sadly 7 of them will die according to the statistics. But if 100 women are diagnosed in a public hospital, 19 of those women will die. And that's according to the most recent statistics from the Department of Health Minister. That is incredibly wrong. That's 12 women extra out of 100 who will die because they're in the public system. I believe it's absolutely criminal, and we cannot persist with a situation that allows such an economic and life expectancy divide to exist in this country. According to the statistics from the National Cancer Registry of Ireland, lung cancer survival rates are also significantly worse in the most socio-economically deprived groups compared to the least socio-economically deprived groups. Again, a massive divide. We in Aontú have brought a bill which will be discussed on the 17th of February, which, if passed, and hopefully the government will support it, will actually mean that there is no longer costs to parking for patients in hospitals, which would relieve some of the economic pressure that's on patients currently. We don't have a cure for cancer, but we should be doing the best we can to reduce the fatalities around cancer. If you're diagnosed with breast cancer in Sweden, you're 7% more likely to survive for 5 years than if you're diagnosed in Ireland. In Britain, you're 5% more likely to survive till 5 years than if you're diagnosed in Ireland. And we also need an all-Ireland approach to this. Currently, some COVID-19 antivirals are available in the north, but not in the south. And this is particularly of concern to some hemato-oncology patients who are particularly vulnerable to COVID, and I would call on the government to address this. Garb Mahagat.
I thank the Deputy. I now move to the Rural Independence. Deputy Nolan, you're sharing your 8 minutes left.
Garamagad Cahirlach. I want to begin by commending the Irish Cancer Society for the great and fantastic work that they do all year round, every year. I know that I deal with many families of loved ones who have received shock diagnosis, and I do want to commend the Irish Cancer Society in terms of the information they provide, but also the dedicated nurse line, which I believe deserves a special mention here this morning. It's very professional, and without it, even in our constituency offices, we would be at a loss as to where to direct patients and families. Cancer always comes with a cost, be that emotional, psychological, or indeed financial. But the degree of that financial cost and the impact it has on individuals and their families is something that we can all do something about here. I have been raising the issue of eliminating hospital car parking fees for cancer patients for a number of years now. In September last, I engaged with the Minister for Health and the Minister for Public Expenditure and Reform as part of my efforts to have public hospital parking charges for cancer patients abolished. This followed a meeting I had in my constituency with a representative from the Irish Cancer Society, Siobhan Hayes, who was based in County Laois. The Society have been advocating for the provision of €5 million to public hospitals in order to reduce the cost of car parking charges for cancer patients. It has also called for a reduction in the drugs payment scheme cap to a maximum payment of €100 a month and a maximum payment of €72 a month for single-headed households. And I believe that those changes need to be taken on board. It was very clear to me following my meeting with the Irish Cancer Society that the stress and challenges created by car parking fees has to be tackled once and for all. And I believe that that is something that's very, very doable and that we should all endeavour to resolve. Garamagad.
Thank you very much, Cahirlach. First of all, I want to thank the Social Democrats for this very worthy motion, and I will be supporting it, and I support everything that all the speakers so far have said. And indeed, the family of Padraig and Elaine Clifford, who have paid a very high price with leaving 4 children after them. The 2 of them have died within 4 months of each other, a young couple. I wish, however, to highlight the plight of Karen O'Shea, a 27-year-old girl from Kilgarvan, who is a personal friend of our family and is best friends of my own daughter, Teresa. I even brought her to school. This girl has gone around here in this country undiagnosed with Lyme's disease for more than 12 years. The problem is the department here doesn't recognise Lyme's or won't accept results of blood tests or diagnosis from Germany or other countries. Testing in Ireland is inaccurate. We've only one Lyme consultant in Ireland who can only offer antibiotics. Irish patients have no other option but to seek treatment abroad, which is not covered by the cross-border or treatment abroad scheme because GPs here are not allowed to sign off on it. Not enough education about ticks in Ireland. Many going around undiagnosed. Not everyone comes out with bullseye rash. More must be done to educate people about other symptoms like muscle pain, tiredness and headaches, as early diagnosis can make a huge difference in curing this terrible disease. This lovely girl's whole life is in turmoil. She's had to give up her teaching job in St. Brendan's College in Killarney. The cost of 4 weeks treatment for her in Germany now is $35,000, and she has to embark on a GoFundMe campaign to help her to get this treatment. Thank you very much, Colin.
Thank you very much.
Thank you, Colin. Higher numbers of late-stage cancers are being diagnosed because of screening delays caused by COVID-19 pandemic, according to Cancer Society. Screening was paused in 2020, and while several checks, bowel checks and breast checks didn't get back into operation for some time, breast check cancer screening currently is running a year late. The Cancer Society also said 250,000 fewer people were screened for cancer in 2020 compared to previous years. We have a cancer crisis in Ireland. My mother in 1984 died from cancer from late diagnosis. During the pandemic, we have lived with cancer in our house. And I have seen firsthand, when you experience it, watching a loved one, having them going in for their treatment. And when I see that GPs cannot get appointments for people for cancer screening, it cuts straight through me to see, because I see it firsthand and have lived with it. My good friend, gone through 3 public hospitals for late diagnosis because she had no private insurance, was diagnosed late but had to pay €1,000 for a private hospital to tell her she had cancer. Late diagnosis, 3 public hospitals. That woman left her husband and 2 children behind her. I consider us the lucky ones that we have received the treatment and we are working with it. But I hate to see people not getting diagnosed or getting screenings. That is not right.
Thank you very much, Cahill. Look, first of all, I want to thank very much the Social Democrats and for this very excellent motion, which of course deserves all our support 100%. I want to just use the opportunity to thank the Irish Cancer Society for the excellent work that they have been doing. I want to thank in County Kerry, all the Kerry branches, including Kinmare, Killarney, the excellent group in Killarney, one of my close personal friends, Eugene O'Sullivan, who has worked in such a hard-working fashion. Other people like Brendan Ferris and Beaufort, who are organising the Trashing Cancer every year, which was obviously affected by COVID over the last couple of years, but which hopefully will be back again. People like Jay Gallivan, all of the other people who are operate the Kerry Link bus, and how important the Kerry Link bus is for carrying cancer patients to Cork. That is a vital service, ran on volunteerism, ran on fundraising, such an important service to give. And I thank so much the drivers, the helpers, everybody involved in the Kerry Link bus. I couldn't praise it enough if I lived forever. I want to say, whether you're in Ballinskelligs, Ballyferreter, Ballyduff or Ballsbridge, if you get the diagnosis of cancer, you should have excellent treatment. You should be taken care of in a centre of excellence. You should have the best of what is there to help the most positive outcome. I want to thank our doctors, our nurses, all of the specialists who deal with cancer patients on a daily basis, and I humbly mean that. When it comes to us as legislators supporting people who have cancer, we have to ensure that the simple things, the adequate healthcare. I asked last week the Taoiseach to give people who have a diagnosis of cancer an automatic right to a medical card for a period of 3 months, to let them get, how would I say, into their medical treatment. Also such issues as car parking charges. Of course, any person parking a car while they're going to hospital getting cancer treatment, they shouldn't have to pay for it. It's not a luxury, it's an absolute necessity. And just to thank everybody who's involved in caring for people who have cancer, to thank them very much.
I now call on the Independent Group Deputy Pringle. You're sharing your slot.
General Deputy Connolly, thank you. Look, I wholeheartedly welcome and support this motion. That what this motion is proposing should have really gone without saying anyway. The fact that people in Ireland who are diagnosed with cancer are not only faced with monetary hurdles, but actively hindered and hounded by our own government is a resounding disgrace. Surely the €4.3 million that has been thrown into debt collection could have found a more humane, not to mention more efficient and effective purpose to be collected as well. Or perhaps I'm misled into thinking that the HSE has no other areas that require funding that adequately. The very idea of a debt collector in any instance would be more than enough to scare, intimidate and stress any regular person. Imagine that level of fear and upset being laid on top of the shoulders of a person who is in the midst of battling one of life's most physically and emotionally draining situations. In fact, the horrendous thing is that it is only an individual, although that is bad enough, it is also the families. A recent report by the Irish Cancer Society, The Real Cost of Cancer, notes the disastrous lived impact that a cancer diagnosis has on a person, their family and their income and finances. If the cancer patient is an adult, they are often unable to work or have to reduce their hours significantly. This is due to understandably feeling unwell and also due to the impact of treatments. The Irish Cancer Society has also reported increasing problems for cancer patients applying for discretionary medical cards. This is completely unacceptable. The medical system is clearly not serving the people it was set up to serve and needs a complete overhaul. And it's based on an antiquated 1970s piece of legislation that is just not fit for purpose and should be the object of every government to have that repealed and removed. In the unthinkable situations faced by so many Irish families, where a child has been diagnosed, more often than not, one parent will cease work in order to be able to care for their child as well. For those fortunate enough to be unaware of the realities of cancer treatment and care, it does not limit itself to checkups and a day in hospital to receive the treatment in question. For many, particularly in rural areas like Donegal, even just receiving treatment means travelling to a larger hospital hours away. This undoubtedly incurs parking fees, food, drink and often accommodation, and also the voluntary transport providers that provide the transport for them from Donegal to Galway on the cancer bus, aptly named, but it's vitally important and very good service that they rely on. But that service relies on fundraising. In this day and age, it doesn't bear thinking about. In the children's hospitals, there is limited parental accommodation offered. While the organisations that fund and run these accommodations are providing hugely important support to families desperately in need, there are still ancillary costs involved. When the illness and treatment is ongoing, these costs accrue. The report notes that monthly costs can run up to beyond €1,000 a month. Even without the additional costs involved, the Irish Cancer Society reports that cancer patients face a loss of €1,500 per month on average. That means that people facing one of life's toughest battles are already feeling financial strain before additional costs even begin to add up. Currently, the supports that help in the way the everyday reality of those in the midst of cancer treatment are offered by NGOs. I applaud the volunteer driver service and the NGOs that provide night nurse care when a patient is terminal and care has reached the end of life. These are all exceptionally helpful. However, it saddens and angers me that while we have charities and NGOs providing empathetic support, the government is not only failing to do likewise, they are actively adding to the huge burden that cancer patients and their families face. Is it not enough to hear that the dreaded words is cancer and the emotional toll that takes on a person and their loved ones? Is it not enough that the harsh reality is that when people face cancer, not only do their finances cease to improve, they fall considerably? Once again, I support this motion and call on the government to abolish the parking rates, or at the very least implement the promised cap on parking payments, ensure a complete overhaul of the medical card system, and put an end to the debt collection and scrap the ridiculous €80 charge, inpatient charge for cancer patients.
Deputy Pringle, Deputy Conley.
Garmil Magat Kahiri, agus a Rish Mavwikas, don Den Lahi Soshilta, Soktan Runcha, a Coruscor, and Nadala, agus an Jesho Horch, Dumarchak, the Dala, Porchik, Lacus, Gisporacht. I welcome the motion. It's a very basic motion. They've been very, very modest once again, and they're calling for the abolition, which has been set out of the €80 inpatient charge, stopped the abominable practice of debt collectors, and to follow up on the commitment in the programme for government to introduce a cap on car parking. And you're nodding, Minister. And again, you have been put in this position because the Senior Minister is absent. And I might come back to that in a minute in relation to why he's in Dubai, in relation to the privatisation of the health service, the marketisation of it and products. And if I have a chance, I'll come back to that. But it's interesting that what this motion highlights is the inequity in our health system, not just unfortunately, with people who are suffering from cancer. And in my mind, as with all TDs, I have somebody right in my head now who's suffering from cancer, very close, and a member of my family that died. All of it irrelevant, because in a sense we could all come in with anecdotes. And the reason that we have a cancer strategy is to avoid that, because all of the inequities have been highlighted repeatedly. That's what Sláinte Care was about when it came together to have a health service that was fit for service. And notice the word service, not a product, not a company, a health service to serve everybody equally, because that's what we deserve as human beings and citizens. And so it's significant that we're taking this debate today, and on Friday the 4th of February is World Cancer Day, an annual event led by the Union for International Care Control, of which the National Cancer Control Programme and Irish Cancer Society are members. And the National Cancer Care Strategy, which is underfunded and not being implemented properly, the objective number 23, what's the objective? To reduce inequalities in 5-year survival for all cancers, and they list them out, in respect of which the target is to have no greater than a 3% difference in the survival rate between, and I don't use the word deprived because I don't like it, between those most seriously disadvantaged in society and those not, to reduce the distinction in their survival rates, and they go on. In both 2019 and 20, the official position was that survival is 11.4% lower in most disadvantaged communities that serve our most disadvantaged patients than those who are not disadvantaged. Now, we could use this for everything that we talk about in terms of health. It's already been mentioned by Deputy Kenny in relation to the geographical differences in the country and your survival rates. And I come from Galway, supposedly a city has a hospital with a centre of excellence where somebody very close to me could not get an MRI and was in stage 4 cancer. I won't go on because I wouldn't be able, and I'll stick to the issue in relation to this, that this motion focuses and puts the spotlight on a much bigger issue, that we are commodifying and making products out of our health system. And the Senior Minister is often, where, Dubai is it? At a conference where I understand, or an expo, where I understand the difficulty was that companies are upset because they don't have enough free access into the health executive in relation to their products. When you should be at home here talking about the importance of a universal healthcare service for all, including patients who have cancer that we all know about, and not off in Dubai. And it's just simply unacceptable. We've been through all of this. We've been through all the criticisms and the denunciations of our health service. That's why we got Sláinte here. Roisin Chartall as chairperson did a great job, and so did the committee in producing that, so we could avoid these type of excuse for debates in giving anecdotes about who suffered in my family, which is really important. I'm not belittling it at all, but we should be beyond that in terms of the strategy and implementing it. And that's why the minister should be here and should be held to account. Garmagat.
Now move back we now move back to Minister Rabbit. You have 10 minutes, Minister.
Thank you, Chair. And I want to thank the Social Democrats and all the deputies who contributed to this debate on the financial challenges facing those diagnosed with cancer. And I suppose I'm not unique myself, no different to Deputy Connolly or anybody else in this House. We all understand the traumatic events associated when you have a family member within your own household. So I'm not unique. And I think that the sad case that Deputy Danny Healy-Rae referenced there earlier on needs to be also recognised, where you'd lose 2 members of one family within a short period of time to cancer. And I think the morning that's in it, I would like, Chair, to acknowledge a colleague of my own who just passed away this morning, a former member of the House, Noel Tracy, who himself passed away due to cancer. And I'm taking this on behalf of Minister Donnelly, so I will keep to the script from the department, because that's where I get most in trouble, when I don't keep to the script. So. All right, but I would like to agree with Deputy Nolan in commending the Irish Cancer Society and Nurseline for all the wonderful work that they do. And it is greatly appreciated. And we all have cancer care groups in all of our own communities. Like I can talk about Gorton, I can talk about Ballinasloe, and you all have them in your own constituencies. And without that relief valve that we have in our communities, particularly us that live in rural areas, we're dependent on that because that is our support mechanism to supporting people in the community. That's their access point to information and understanding. And we talk about the local bus link, are the people who volunteer to drive the cars. We cannot have a motion here this morning and not acknowledge their existence and what they do to support families. As we have already heard, this government has prioritised the delivery of the National Cancer Strategy and invested significantly in improved services and support for cancer patients, including almost 100 million in new development funding in the past 2 years alone. This funding has enabled such improvements as number one, the development and launch of Ireland's first national skin cancer prevention plan, new referral pathways for patients with suspected cancer, the appointment of the national clinical leads in psycho-oncology, cancer nursing, and children, adolescents and young adults, the opening of a new radiation oncology facility in Cork, and the construction of a new facility in Galway. Further centralisation of cancer surgery in the 8 designated centres, the repatriation of the CAR-T targeted immunotherapy services to Ireland, and increased use of previously approved cancer drugs with increased patient numbers. We're also continuing to develop survivorship services, including psycho-oncology services, to improve quality of life of those living with and beyond cancer. Patients consistently identified psychological impact of cancer as one of the most enduring challenges of a cancer diagnosis, which can occur at any point in the cancer experience. And I do not want to labour the point about progress being made, and I do understand that this debate is focused on the financial challenges facing some individuals with cancer. However, it is important that the House does not lose sight of the improvements in cancer care over recent years, even as deputies rightly seek to identify areas where we can improve further. One of the areas of improvement identified by deputies is hospital car parking charges. These charges are often highlighted as an additional burden to cancer patients and others who must attend hospital frequently. That is why the Programme for Government commits to introducing a cap on the maximum daily charge for car parking for patients and visitors to all public hospitals where possible, and introducing flexible passes for patients and their families. And that is when I met with the local advocate from the Irish Cancer Society. That was something that they had brought up with me. In my own experience, it was a burden. In my own experience, even trying to find a space in the local hospital car park, there should be designated spaces as well left aside so that there's ease of access. We're dealing with people that are very, very frail, that need to move from the car to the oncology unit. So not only should it be capped, but also it should be designated and in a more appropriate setting, not at the back of the car park where somebody has to walk 300 metres and they haven't the strength to do so. Consideration is currently being given to how best to ensure this commitment is addressed, taking account of existing arrangements already in place. While this remains ongoing, the HSE has advised that hospitals that currently charge car parking fees are very cognizant of the financial implications of parking costs. Many hospitals have introduced maximum daily fixed parking charges and reduced rate parking for long-term patients and visitors for whom the patient of full rate would cause hardship. Now, saying that is only as good as it's communicated at a local level. So there needs to be better, clear communications from the local hospitals as to how the people can access that support. That in itself would be a help. The use of debt collection services has also been referenced. Debt collection is managed at a local hospital level, and the Minister has been assured by the HSE that any such activity is managed in a socially responsible, ethical, efficient and cost-efficient way. This debate has highlighted the financial burden that long-term illness such as cancer can place on individuals and their families. It has also shown that there is help available, and we must ensure that people know how to access supports, whether that is applying for the medical card or seeking other assistance. The Government is taking steps to address long-standing issues of affordability in access to healthcare. Budget 2022 again provided significant funding towards the achievement of universal healthcare and in its three pillars of affordability, quality and accessibility as envisaged by the Programme for Government. Specific affordability measures being advanced under Budget 2022 include the extension of the GP care without charges to children aged 6 and 7 years of age, the abolition of inpatient charges for children aged 16 years or less, dedicated funding of 30 million to ensure access for patients to new innovative medicines, the reduction of the DPS threshold to 100 per month from the 1st of January, additional funding to enable progress to be made in addressing issues around access to community dental health services for medical card patients in 2022. The reduction in DPS thresholds and funding of innovative medicines may benefit cancer patients more directly, but the more other measures will also ease financial pressure on individuals with cancer and their families, depending on their circumstances. Moreover, in line with commitments made in the Department of Health's Statement of Strategy, a review of the eligibility and charge system is planned. This reflects the fact that eligibility and some charges have been highlighted as a potential obstacle to patients access to healthcare. Our current system successfully protects many people from financial hardship as a result of illness, but there are clearly gaps that we must address. The Minister for Health is committed to addressing those eligibility anomalies or barriers to ensure the health system cares for those who are in greatest need first. However, in line with Sláinte Care, he believes that it is best achieved through a systemic, strategic approach to universal healthcare. It is generally acknowledged that Ireland has an unusually complex system of entitlements to publicly financed health service. A focus on waiving fees or charges for individuals based on particular medical conditions would only increase that complexity, while potentially giving rise to issues of equity and indeed feasibility. The government is instead committed to continuing to make progress steps towards universal healthcare in the months and years ahead. We have shown that it is possible in our response to COVID-19 by providing universal access to testing, diagnosis and treatment for COVID-19 without charge, and extending free teleconsultations to all COVID-related symptoms to whole population. It is incumbent on us to learn from the experience and develop services so that the people with cancer or indeed other illnesses can access the right service based on the need and not ability to pay. The government will continue to invest in our health service and will work to improve protection and support for those on lower incomes while continuing to expand capacity and service provision. The implementation of the structural reforms we are progressing will ensure that all patients, including those with cancer, will get faster and more efficient treatment regardless of means. Thank you, Chair.
Move back to the Social Democrats. Deputy Murphy, you have the 10 minutes left.
Yeah, thank you. First of all, I'd like to thank all of the deputies for their contributions and for their support in relation to this motion. I'd also welcome the return of people into the gallery who have a particular interest in this area. And in my own area, I'd like to acknowledge Erica Tierney, who is a regular, we regularly chat, and she's the advocate in my particular area. We particularly kept this motion narrow, focused, because we felt it was something that could be done. And you've acknowledged, Minister Rabbitte, that you would like to deviate from the script, and I wish you had, because essentially I didn't hear the opposition to the debt collectors, and I didn't hear the immediacy in relation to the scrapping of this inpatient charge. What you're telling us is going to come in the context of review, but so there isn't an amendment to this motion opposing it, but neither am I hearing that you are going to do something in the immediate term, particularly in relation to debt collectors, and particularly in relation to the inpatient charge. Indeed, Minister Butler, I'd like to wish you well and your family well. Would have had a very similar experience on a couple of occasions in our household, so I do know what it's like when it comes as a bolt out of the blue, because we all assume good health. And this comes as a complete shock. When somebody gets a diagnosis, very often there's surgery, then there's chemotherapy, radiotherapy, and really, you know, the kind of things that people have got to assume in relation to their own survival. The last thing they think about is the financial implication, until they're forced to think about that financial implication. The last thing they expect is that bill. I couldn't get over it, actually seeing it. But anyway, because it just, and I'm sure that is how others feel. But I don't think people expect to see a debt collector on their door. I really don't think. Like that is just inhumane. It has to stop. We know that there are, there's a reality facing cancer patients, and like when we talk about medical cards, who are the ones that are impacted by what we're trying to do here? There are people who don't have health insurance, and there are people who don't qualify for a medical card. Now, I accept that there can be discretionary medical cards, but that is that takes quite a bit of time, and they're not always granted. We're looking at that group in the middle. And that group in the middle are very often looking at their household income and they're wondering, what they can cut out because of housing costs, because of, the increase in the cost of living and all of that. And very often, health insurance is not an option for people in that particular group. If you start looking at the qualifying criteria for a medical card, for a single person living alone, it's €184. That's below the minimum social welfare rate. If you're looking for 2 adults and 2 children in a household, the qualifying criteria for a medical card, for entitlement to a medical card, is €342. Like, we're talking about very low levels of income for the qualifying criteria for a medical card. Then if you look at the parking charges, and I've had responses to, well, I had one back in last year in relation to the take for the hospitals, and I'll quote the 2 hospitals that you probably would be most aware of. For example, in 2019 in Galway, the University Hospital in Galway, it was 1.4 million was the take for parking charges. But the following year, 2020, it was 630,000. And the difference was that the visitors weren't there. COVID had that impact. So it's showing that is really very much around the patients, if you like. The same in Waterford, it went from 1.2 million in 2019 to 469. So we can actually take out what is the amount that is, and COVID has given us that piece of data, and that is not exclusive to cancer care, but it is giving us some sort of a picture about the kind of charges. In 10 hospitals, for example, I was told there are no charges, and it can vary very considerably depending on the hospital. And some hospitals have introduced a cap, and I want to acknowledge that. Cancer is very stressful, and we know that, and stress doesn't help health outcomes. So consider what it's like for a person having that financial burden. And essentially, this was expected when Sláinte Care was introduced. This was expected that this would be one of the things that would have been dealt with in year 1. We're still not hearing about when those inpatient charges are going to be dispensed with. What we want people to do is to focus on their recovery when they get that diagnosis. And a study, for example, by the RSI found that nearly half of all cancer patients found that their cancer prospects were negatively impact on their work environment, with the highest negative impacts reported by women, younger workers, self-employed, and concerningly those in the public service. I think we need to do a little bit of examination of just exactly what that is. The same study found that the financial impact of cancer was driving cancer patients back to the workforce long before they were ready, which is not good for healthcare outcomes. A survey by the Mary Keating Foundation found that more than half the patients focus more on the financial difficulties than their own treatment, recovery and well-being. I understand this conference out in Dubai is about wellness and well-being. We'd like to introduce a bit of that into the care of our cancer patients. And I've got to say, I find it very at odds that we're with the focus that there should be, why that conference was prioritised the way it was. But I thank you both for being here. The St Vincent de Paul, who told us that they've received 1,400 requests since 2019 for assistance for people who are struggling financially with a cancer diagnosis. They told us that they recently began supporting a one-parent family, a mother and 3 children. Her second youngest is being treated for cancer and is required to attend weekly appointments in Dublin. The parent had no childcare, so all 3 children travelled, costing about €90 in petrol, tolls, parking, specialist snacks for the child that's ill before the family car had broken down. They ended up having to get a loan for that. That's the kind of thing that completely throws a family. And indeed, where somebody has to give up work because they're caring for a family member, you know, you can see the kind of costs that are involved. So our motion has not gone so wide that it is not achievable. It is looking for very deliberate and very limited changes. And those limited changes is that people will not have a debt collector on their doorstep. It'll be that these inpatient charges are dispensed with. I just don't think people expect to see that kind of a bill coming through the door. In addition to the diagnosis, I'd like to acknowledge also the work that was done by the examiner in a series that they did, giving people's personal experiences, because I think people understand better through people giving their personal experiences, but it shouldn't come to that. That people have to do that. The last 2 years in the pandemic have been incredible, and we all know that. We know there's going to be late diagnosis. We know that this is going to escalate rather than reduce in terms of the number of people that are impacted. And the last thing we want to do is for people to be missing, for example, the care and the appointments because the financial burden doesn't allow them to do that. So the €80 inpatient charge needs to go. The parking charges need to be at the very minimum reduced, and I accept that it's not straightforward. Ownership, the nature of our health service is quite fragmented in terms of it's not all HSC, some of them voluntary hospitals, and so on and so forth. But I think if there's a will, there's a way to actually deal with this and reduce that burden. And the car parking charges is a very significant burden on households and individuals. And Minister, I would like to have heard something very focused and very, with timelines. I didn't hear that today. That aspect is very disappointing, and we will be following up on this. Thank you.
G-sport module costas cura malcha, agus is see on Keshno, gun in teether and Tarishkin, that the motion be agreed? It's agreed. Garmagif.